We have two closing remarks. First is from the Ms. Margaret Tan, Minister Counselor for Economic Affairs, the British Embassy in Tokyo.
Good afternoon, everybody. I think I speak for everybody here when I say what a fantastic event this has been this afternoon. I think full of really thought-provoking ideas and discussion and some calls to action to inspire us all when we go away from this building. And so I think some thanks are in order. I would like to thank Nagasaki University very much for hosting today's event. And of course, I would also like to thank HGPI for a couple of things, actually. So first of all, thank you very much for inviting a representative of the UK government to be here. I'm delighted that it's me and that I've been able to come here and demonstrate our support for your work and for what you've achieved with the event this afternoon. But much more importantly, thank you very much for what you've done to organise this event and to make sure that these issues are really on the agenda. I think one positive piece of progress in recent years is that something you hear much less about now is the whole question of whether climate change exists and whether it's a problem. So that's definitely something that's very positive. But I think sometimes you can still see a tendency to think of it as an environmental issue. And so you have it, here's the, this is the climate change, here's the question of economic growth, here's the question of public health. And when you think of it like that, it ends up becoming something where you have to work out a sort of balance of a balance of priorities. And I think what we've heard this afternoon is really ample, extremely compelling evidence that climate change is not something that can be thought of in terms of prioritizations, competing priorities and trade-offs. And it's something that's going to have an impact on all aspects of life, all sectors of the economy. And so it's something where responses also have to come from all sectors of the economy and from all aspects of life. And I think it's really, really important for people to understand, really, really viscerally understand and feel what those linkages are in order to ensure that there's enough support and momentum to take to make sure that action is being taken to keep climate change as limited as possible. And so, I mean, that's one reason, for example, why the UK government has been getting involved in a number of international initiatives. For example, the COP26 health programme that was established in 2021 by the UK, WHO and civil society partners, which have led to over 60 countries making commitments in the area of climate and health. Dr. Naira also mentioned the Alliance for Transformative Action on Climate and Health, or ATACH, which was launched in June last year. And this is a network of countries and partner agencies that promotes collaboration to deliver on the COP26 commitments. There was also some discussion about decarbonising health systems, and this is an area where the UK has been working to implement our own healthcare resilience and net zero targets. So, for example, NHS England was the world's first national health service to agree net zero commitments. I think Juliette White mentioned a little bit earlier what the impact of that has been on the NHS's supply chain. We also have something called the Public Sector Decarbonisation Scheme, which has invested over £600 million in renewable energy generation and energy efficiency measures. And that included things like solar farms, looking at things like replacing ambulances with low emission alternatives. And digital technology will also improve healthcare efficiency and accessibility, as well as sustainability. And that shows, as Dr. Dangour said in the first keynote speech, how actions to improve, to work on climate change will also have positive impacts in other areas. So I think that's all that I'd like to say now, but I think all of us following on from this afternoon's event will be going away from here reflecting on the issues and the suggestions that we've heard about. And I hope we'll go away advocating in your countries and organisations for changes that will recognize this linkage between climate and health and look for ways to adapt healthcare systems and reduce carbon emissions, because in fact, literally, our lives do depend on us all taking action. Thank you very much.
Thank you very much. Next, we'd like to invite Mr. Kozo Akino, member of the House of Councillors, State Minister of Finance, for his closing remarks. Thank you. To all those attending the Nagasaki Planetary Health Expert Meeting at the venue and online, and to all the experts who were speaking at this meeting from home and abroad, thank you so much for your participation. I am a member of House of Councillors and State Minister of Finance, Kozo Akino. I respect Dr. Shigeru Kono, President of Nagasaki University, and I also like to thank Dr. Kurokawa. Nagasaki University is my alma mater, so I am sorry that I can only participate online due to my official duties, but thank you very much for giving me this opportunity to deliver my closing remarks. Planetary health, what we have talked about today, for the health and of the people and the planet, they are closely related. That has been learned today. The Lancet Carter study, as well as World Economic Forum report, analyzing risk to the international community, and the IPCC report released in March of this year, have made it clear that there is a close connection between the planet and human health. And it also points out that anthropogenic impacts are a threat to nature, ecosystems, and people. So health hazards to human society have been reported. In order to respond to the global emergency, we have heard that planetary health will be discussing this topic at G7 Summit in Hiroshima and at the G7 Health Ministers meeting in Nagasaki. And this year, from November 30th to December 12th in UAE, there will be a meeting on 28th Conference of the Parties to the United Nations Framework Convention on Climate Change, and they are going to take up the agenda to discuss health issues in depth for the first time. Multilateral development banks, MDBs, World Bank, and the Asian Development Bank, which provide financial support, technical assistance, and intellectual contributions to poverty reduction and sustainable economic and social development in developing countries, are also working to address the climate crisis and healthcare issues. And Japan is contributing to the development of developing countries by participating in their operations as a major shareholder through its investments in MDBs. In this kind of situation, we have been able to reaffirm the need for a renewed and growing interest in the relationship between human and global health from a planetary health perspective. And what we can do is for creation of the sustainable community, we need to think hard and act on our own lives, work policies as well. So more and more attention is being paid to the relationship between global environmental issues and human health. As international discussions and efforts continue to progress, we as members of the community are expected to contribute by taking a sincere look at environmental issues and human health in our own positions and in our own work. I belong to the Ministry of Finance, but we will continue to bridge with the Ministry of Health, Labor and Welfare, Ministry of Environment, and Ministry of Agriculture, so that we can maximize what we do and to stimulate domestic debate and promote responsible responses in cooperation with the international community. I would like to take this opportunity for the valuable exchange of opinions to all the participants today. Thank you so much.
秋野先生、ありがとうございま
Thank
し
you
た。
very much, Mr. Aquino. With that, we have completed all the programs for today. Thank you very much for finding time out of your busy schedule to participate in the Nagasaki Planetary Health Expert Meeting.